One of the things I would like to ask you about is this very polarizing subject that now lots of people are on that fence in vaccines,
Hmm.
and understanding that it's incredibly, triggering to some. I
Hmm.
mean, parents have actually made decisions for their children that harmed them.
Hmm.
You're told it's life saving. You have to do it by many doctors. Where do you fall on that? Because, if you don't go a certain way, you're an anti-vaxxer, you're attacked, you're kind of thrown under the bus as woo-woo anti-science. But if
Right.
you just try and make a general case, like I Dr. Joel Warsh on, who's just trying to show what, informed consent. Some of these aren't great. There's aluminum and they've been doing this. They don't even know how much is really in them by studies from independent sources.
Right.
How do you go about discussing that sort of topic with patients?
What I learned many, many years ago from my mentors was with the discussion of vaccine, and this is what I'll talk to a patient about, is what we have to do is we have to weigh the risk of the illness versus the risk of the vaccine, per
Hmm.
se, in general. So one of my great benefits is since many of the things that are being vaccinated against are viruses, we look with COVID was the perfect example. The conventional model has no treatment for viruses,
Hmm.
per se. So, and we saw the catastrophic failure of trying different things to treat a pandemic for what's going on. So somebody says, and we look right now, there's what 13,000 kids or something that have had measles, and so it's coming back. And said, oh, so the problem is that supposedly only like 92% of kids have been vaccinated. I said, well, the challenge with conventional model is they don't have any treatments for measles. So the only thing they have to offer is a vaccine per se. And so my patient, I'll be honest, my patients, with rare exception, never vaccinate their kids. Why?
Hmm.
Because if they get a viral infection, I say you're going to do this, 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 and
Yep.
this. And we don't have to. So, is measles a life-threatening condition? Yes, I believe I've heard two kids have died of measles. So, which is very tragic, of course.
Hmm.
So
Hmm.
yes, it potentially somebody, but of the 13,000, they're miserable. And who is it more miserable for? It's more miserable for the parent
Yes.
because they can't put their kid in daycare. They have to take off work. It's inconvenient for that aspect. So we've been sold this idea that because we have no other therapy, this is the only thing we can offer people.
Right.
I say that is not my approach. I have lots of things to offer for whatever the condition is. And for many, many years, the one that I thought was pretty is tetanus, per se.
Mm.
And I said, well, it's like, what am I going to do for tetanus? But actually, we have a homeopathic that actually treats that. I've actually
Mhm.
treated, and people stepping on rusty nails and all that kind of stuff.
Yeah.
So I feel comfortable that I have the ability, but I know 99.9% of people does not have access to somebody who has that knowledge.
Right.
Maybe as their primary care physician who could treat it. So actually the same thing. I'll go back to dentistry and fluoride. I'm not anti-fluoride. What I'm saying is show me in the equation of cavities how fluoride. So in order to have a cavity, you have to have a tooth, you have to have fermentable carbohydrate, and you have to have bacteria. That doesn't say fluoride. Fluoride has
Mm.
nothing to do with cavities. If you brush your teeth, disorganize the plaque, you don't need fluoride to do anything per se. And now Utah, of course, has just banned fluoride from their water system about a month
Florida as
ago.
well. Yeah.
Yeah, so it's coming. People are realizing, and when I was in dental school, we used fluoride. Fluoride was used to treat osteoporosis 50 years ago.
Mm.
That's what I was taught but unfortunately they said, oh, if you fall and break your hip, now it's a lifesaver. We can't put the bones back together. This is not a good idea because the bones became so brittle. So
Mm.
I look at fluoride the same way I look at vaccines. There are people who have no other option. They know nothing about it. They have no access to any health care. Probably for that kid, maybe fluoride would be beneficial. Maybe a vaccine would be beneficial because what are they going to do if their child gets some type of a viral infection and they don't know hydrotherapy? They don't know a
Right.
homeopathic. They don't know an herbal medicine. They don't have a practitioner that they can talk to. My patient population has options, and more people will learn the options. I'm not an anti-vaxxer. I'm for people who understand. And in fact, I would say, in fact, 50 years ago, it used to be, if somebody had measles, put them all in the same room.
Right.
You got chicken pox, put them all in the same room.
Yep.
Have everybody get, now you have
Throw a
permanent
party.
immunization, throw a party per se. But now all these kids have been vaccinated, so you can't find a person who gets chicken pox to get them into this room so they would naturally get it, type thing. So, and more, and I can't tell you the number of statistics, but I believe in Arizona here, if I'm not mistaken, by the time a child is 18, if they followed the straight CDC schedule, they would have about 60 vaccines
Yeah.
before they're 18. In
Right.
my day, when I was born 75 years ago, there was one. We had this little
Yep.
thing that they scratched on your arm. That's the only
Yeah.
one that I've ever had. It's the only vaccine I've ever had, per se, in my 75 years. Although I had to have the COVID because I couldn't go to work without it. So I
Mm.
did. I wouldn't have done it, but I was
Yeah.
forced to, per se. I didn't feel I needed it because I had so many other ways of treating it, per se, and so I have access to those types of therapies. So vaccines for some people are life saving. For many people, and what I used to say to a parent, do I need fluoride? I'd say no. And the reason I'd say no is because you have enough knowledge to know that it's not good. So if somebody says, do I need vaccines? And you're asking me, you don't need them because you
Yeah.
know that there's some other option. If you don't ask me, you're probably
Right.
going to vaccinate your kid.
Right. And that comes down to the informed consent part. If you truly
Right.
understand what you're doing and can weigh the risks, and not just listen to some governing body saying you need it, right? Which we know
Right.
that governing body has been wrong on several occasions in history.
Correct.
That's what it really comes down to. And you're right. I don't think it's anything about anti or pro. It's just about
No.
informed consent and understanding that each individual situation is different. You cannot group everyone together at all. Some have predispositions that you don't even know about and require it. Some don't, and how you go about it even is a
Right.
big part of it. It's the why and how, not even the what so much.
Yeah. At 100%, the individualization, and I think that's the one of the parts that's missing in medicine.
Yeah.
Because if you have disease X, you can open Merck manual or a medical book and it says this is what you do. So whether you're in New York City or Florida or Phoenix, Arizona, the treatment is the same per se, but it's not the same because we have to individualize the therapies. I tell somebody if I saw 10 patients with arthritis, I would have 10 different treatment plans because the reason that they have it is not the same as the other nine per se.
Absolutely.
So if you individualize treatment, which takes a little more work than just everybody gets the same thing, for what's going on, that's how you get people to understand that there is light at the end of that tunnel, and we don't have to do what everybody else is doing.
Wonderfully said.